Hi, I'm Martha, occupational therapist. I work in home health. As I get this channel started, I thought we should talk about what is occupational therapy, because I gotta say, nobody knows. My patients don't know what I'm going to be doing. The doctors a lot of times don't know, and people near and dear to me don't always know what I do. Occupational therapy will help you with anything that occupies your day. And it can be anything at all. We are in the NICU. We are in hospice, schools, early education. There are specialists in mental health, driving, neuro, ergonomics, vision. I mean, endless. So whatever comes up in home health, part of what I love about it is that I get to come into your house and say, what's the hardest thing you're dealing with? What's going on? What do we need to take a look at? I'm getting this reflection, can't reduce it. So yeah, it could be anything. And people have different needs. Some people need someone to help them on the toilet, and they don't mind because the help is there and it's so hard to do. And other people can't stand the thought of having to ask somebody to do something like that. So what's important to one person isn't important to another, and that's why it's not dictated by me. We work on it together. We're going to figure out what's hard for you, how I can help you, and we're going to move forward with that. And some things, it's pretty easy to predict what we would do to make something happen, and other things we need to talk about. Something that might be good for one person isn't good for another. If someone has weakness in their hands, they're not going to be able to use that device. Also, I'm not trying to spend your money. I'm not going to tell you to buy a bunch of stuff. We're going to talk about what's reasonable. I've worked in areas where people were choosing between food and heat, so I take that pretty seriously. And if I'm so sure you could use something, but you know you're never going to use it, why have it? Why am I even talking about it? That's a waste of time for all of us. So anything that occupies you. In home health, we have ADLs, activities of daily living. Getting washed, getting dressed, using the toilet, that kind of stuff. And then there's indirect activities of daily living, like cooking the food, right? ADL is food to the mouth. Indirect is preparing the food. Home management, medication management, how to use your cell phone. A lot of patients have trouble managing their cell phone, especially when they are just overwhelmed, just mentally overwhelmed by pain or their other symptoms, and then they have too many people calling them, and they're not that, it's a lot. And more than other people might think. If you've never been a patient, you might not get it, why some things are hard. But we can do everything. We can help work on range of motion, strength, balance, endurance, lots of gizmos out there that can be really helpful. We're everywhere, and we do all kinds of cool things. One patient, the hardest thing that we had to work on was getting her to be able to use the controls for her hospital bed. It took about 3 weeks. We had to figure out her vision and mark it on her remote where she needed to push. We had to work a little bit on hand strength, and we had to have a setup on the bed so that if she pushed, there was some resistance. So it took a lot. I had another patient who wanted to be able to touch the back of his head. Okay. We did that. I said, what's next? He said, opening a bottle. We did that. Okay, what's next? So that's what occupational therapy is going to do. Do we help people find jobs? No. But we might be a part of someone's plan to return to work, which is kind of a whole other conversation. But not occupational, like I don't need OT because I'm retired. No. What's occupying your time? What's occupying your mind? What do you want to be able to do? I always say that my patients are really not trying to get to the art museum. They just want to go to the dollar store. They just want to do their regular things. They want the freedom to get up and go and do whatever their thing is. And that is what occupational therapy does. It's pretty cool.